Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together here at the Virginia Institute for Public Policy. My name is Joe Thomas, and you can find out more about all of our work at the Institute at vainstitute.org. Joining us first off on the program is Phil Kerpen, president of American Commitment. Phil, Happy New Year and welcome to the program. I hope you had a great Christmas season.
Yeah, thanks. It was pretty good, and Happy New Year to you, and I hope you had a good holiday as well.
Well, hopefully 21 means we can put 19 behind us. I wanted to spend a little time talking about the way we're managing COVID-19, not just in terms of the medical treatments, the lockdowns, the restrictions, the travel restrictions, the way they're using our permit culture against our businesses, but also in starting with, I think, the idea of the vaccines, how they're getting out to people. Now we're hearing stories that there are medical facilities that are diluting the vaccines so that they can give them to more people. I'm not sure if that works. I'm not an epidemiologist. I don't know if you have talked to anyone about this. Let's start off with the vaccines and the hierarchy that they've been using to get the vaccines out to people so far.
Well, the CDC recommendations are not very good, to put it mildly. They got hijacked by a social justice agenda. The epidemiologist who ran the models is a person named Joe Taylor in Atlanta, who is a gender non-binary defund the police activist, who basically explained that if you did it by age, which would be the best way to limit deaths, the deaths are by far among seniors disproportionately. If you did it by age, that would be racist because there are more old white people, and so we must prioritize groups of essential workers, even though they're at very low risk, over seniors. And so the CDC recommendations are badly distorted and polluted by a social justice agenda. They backed off a little bit on that, and after there was a big public backlash, they basically said seniors could be at the same time, the same priority as essential workers. But we've got a handful of states that are basically saying, no, we're going to ignore the CDC and actually go by the science, vaccinate based on age, Texas and Florida being the most notable ones. But most states are not doing that, and so most states, including Virginia, have a vaccination schedule that is not optimized to save lives. And a lot of the early vaccinations have been among young, low-risk people. The numbers are getting somewhat better in Virginia. Initially, they had almost no seniors. Now they've done a pretty decent job of getting into the nursing homes, which, of course, is where about half the deaths are, even though it's about 1% of the population. So that really is the urgent priority. And that is really the crucial thing with this vaccine is we've got to get it to the people who are at serious risk of hospitalization and death, and get that done sooner rather than later, so that the society can be relatively back to normal. And then, of course, I hope within the next few months we'll be able to offer the vaccine to anyone who wants it as supply ramps up. And then, really, in my judgment, there's no reason we couldn't be 100% back to normal everywhere, because anyone who chooses not to get the vaccine, which is certainly a valid choice that people have, but they would be assuming the risk, and they would be responsible for the consequences. And I don't think you need society-wide, measures at that point.
Well, I want to circle back to that point. I'm going to stick a pin in that because that was one of the issues I wanted to bring up. Phil Kerpen, president of American Commitment, on this week's Freedom and Prosperity. But I find it interesting you talk about the social justice, non-binary director of the CDC that set up sort of the protocols and the template for vaccine distribution. Just this past weekend, an activist doctor at the University of Virginia medical system said that those plans were racist by the way that they were, or at least racially unfair, because the groups that were getting the vaccine first were predominantly white, even in the healthcare industry. So I guess, even the best laid plans of the social justice warrior will eventually be deemed to be racially unfair or biased in some way.
Well, I mean, the real tragedy of this is that there is a big disproportionate impact in the COVID mortality statistics. There is, we've got much higher deaths among racial minorities than we do among whites. I think principally because of chronic vitamin D deficiency. There are other theories as well, higher obesity prevalence as well. So if we were doing the vaccination strictly to minimize death without any of these other extraneous considerations, the biggest beneficiaries of that would be the minority groups because they're the ones who are dying in the largest numbers. And so you don't need to put all these thumbs on the scale and social justice up the whole distribution plan. Really, I really like what Florida's doing, and I'll tell you why. Not because in a model it's the most efficient way to do it. The models will tell you, start at age 85, then move down to 75, and so on, do it based on pre-existing conditions and other risk factors. And, you could design in a computer model a very sophisticated, highly granular prioritization metric. But implementing that would be a nightmare. And so I think the Florida system of just saying everyone over 65, you can sign up for an appointment and get it, is actually going to get the best results because you're generally covering all of the high-risk people in that group, and you're ensuring that as soon as you get the supply, there's going to be demand, and it's going to go into someone's arm. And that simplicity and the efficiency of that, I think, is going to have, in practice, a better outcome than if you tried to do something more granular.
You mentioned the statistics in certainly the mortality, the infection rate, but I think there's an economic factor, not to trivialize the health factor. As our economy over the years, you and I have known each other, Phil, have become more and more service sector directed. We have more and more of our workforce that can't take time off from work because they work hourly wages. As our businesses become more centralized, as they become, they find it necessary to do so just to keep up with the government regulations. The opportunities for people to have jobs that they can work from at home in especially the poor communities, which are predominantly, or at least much more high percentage Latino and African American, that seems to have a factor in this as well, as these are the folks who have to be out at work because they can't take the day off because they don't have 2 or 3 weeks worth of sick time just to use.
Yeah, I think there's a lot to that. There's you've got this sort of rich white liberal mentality that they're the most COVID virtuous because they stay in their houses for months on end and order everything in. But all those things you're ordering in, who's going to the grocery store for you when you go on Instacart? Who's driving to the restaurant for you and picking up your food when you go on Uber Eats? You're not really reducing risk; you're transferring risk. You're essentially paying someone to take the exposure risk away from you, and the people you are paying to take the exposure risk away from you are disproportionately minorities. And so the most COVID virtuous, self-satisfied liberals are actually principally not reducing overall risk in society. They are transferring it to precisely the groups that they claim to care about.
Phil Kerpen, president of American Commitment. You can find out more, as always, at AmericanCommitment.org. And for those who have joined us in progress, we will keep, as always, the archives of these online at our YouTube channel. Search Freedom and Prosperity Radio. Phil, what about the lockdowns? We watched the governor of Virginia say, I'm ordering a curfew. And the first question, I was so proud of the news media, the first question was, and how are you enforcing that? And he said, well, it's more like your mama's, common sense of nothing good happens after midnight. I'm not sure if he was talking about election counting or COVID, but I think he meant COVID. So there isn't really the enforcement there. It's not a curfew. It's just I don't want people out after midnight. But they are using the Virginia Department of Health and the ABC, the Virginia ABC, to go after the licenses of businesses that are reported to not be enforcing 6-foot social distancing and mask wearing. Is this exposing a problem in our business world? We talked about the big companies having to keep up with the big government, but little companies have to keep their licenses and their permits up to date, and it's a way the government can sort of dictate to them terms.
Yeah, I thought that was an amazing exchange. I remember watching that, and Governor Northam with his Southern gentleman accent. Oh, nothing good happens after midnight. And it's that's really not a justification for a public policy. It's almost comical the way that was done. And, to your point, the big box retailers have done very, very well. Those stocks are all up. Their sales are up. They have had, it's been the mom and pop that have had the really devastating impact, and so many small businesses have closed, and so many restaurants in particular have closed. And, the interesting thing, being where I am in D.C. is Virginia looks, relatively reasonable because, at least you can go to a restaurant. Maryland and D.C., they're closed now.
Yeah.
And so, there are sort of levels of extremism here in Virginia. This is, cold comfort to the businesses that have been destroyed there. But it could be worse if you look in the rest of the region. And, Governor Hogan, of course, giving the local option to counties, they all have to prove they're more extreme than he is. So everything he does, they go a couple of notches more restrictive, and Northam did not do that. I think is really a credit to him that he said a statewide at least, so you don't have the one-upmanship making these burdens even more extreme. But yeah, look, this has been devastating period for businesses, and totally unnecessarily. We see basically no relationship between lockdowns, business shutdowns, restrictions, and hospitalizations and deaths with COVID. There is no evidence that these are effective in any way. In fact, to the extent there is a correlation, it runs in the opposite direction. The most draconian lockdowns seem to precipitate the worst outcomes. And so there's a surreal quality to all of this because, at least back in the spring, you could say we didn't know any better. Now we have all of this data, all of this evidence that the costs are massive, enormous costs associated with all of these restrictions, and especially with the school closures, going to have lifetime consequences. And the evidence of benefit has not materialized. And so by far the worst epidemic in the country right now is in the state of California, which has been essentially locked down for the past 9 months. And yet you don't have any rethinking of the value of these measures going on. You just have more threats and more restrictions when you have kind of the natural rise and fall of a virus that I'm not sure we can do all that much about, other than that we now have the vaccines. And I hope that that's going to get us on an exit path here over the next couple of months.
Well, now we're seeing sort of the fruit of this, Phil, and this goes back into a wheelhouse you and I are more familiar to bump around in. Senator Creed Deeds, one of the senior members of the Virginia Senate, said that he's going to propose a massive tax increase on Virginians making over $150,000, and that may include private entrepreneurs. I haven't seen all the details. I don't think there are that many details, but this is what the next shoe that falls is as these states see downturn in tax revenues from these businesses being closed or curtailed, they're going to have to make that up somewhere.
Well, you don't want to be a high tax state because we're seeing huge migration changes right now in the United States, and everyone's moving in the direction of the low tax states. I just saw the U-Haul data came out this week. And, the top states were Tennessee, Texas, and Florida, the non-income tax states that have been relatively open throughout this whole thing. And, Virginia was all the way down in the middle of the pack. And Virginia used to be a big destination state, and it's not anymore. And, if you have a big tax hike, you're going to become a big outflow state. You're going to be down with, the other high tax states that are driving people out, Massachusetts, Maryland, New Jersey, Illinois, California, and so forth. And in particular, if you're driving out your high-income, high-productivity people, the ones who run businesses, create jobs, and so forth, that has a big downstream effect on everyone else and on wages and on job creation. And so as much as it might be nice in a vacuum to say, hey, I don't like rich people, we're going to hit them up for money so that we can spend it in our budget and so forth, in practice, you're probably just going to push a lot of them out of the state, and they're not going to be there for you to tax at all. And so I think you've got to be mindful of the competitive environment right now, especially when you've got you've got several states that currently have income taxes that want to move the other way and repeal them. And Mississippi and Utah may do that, in these upcoming sessions. And so I think tax hikes at the state level are pretty dangerous right now when you've got all of these other headwinds for small businesses.
Phil Kerpen, AmericanCommitment.org, where you find him there. Phil, what about the federal policies regarding COVID-19 in 2021? The incoming Biden administration has, talked about greater stimulus monies. Eventually, that's going to have to start coming from somewhere. I can't imagine the yuan will continue to be second-tier currency to a diminishing valued American dollar if we continue to go down this Keynesian fever dream of just sending people $2,000 checks every few months. What do you expect the Biden administration to do fiscally regarding this?
Well, I think the Biden agenda is extremely anti-growth. They want to ban state right-to-work laws. They want all kinds of new global warming regulations. They want tax hikes. They want to repeal the Trump tax cuts. And so, I think to the extent that they can enact that agenda, it's going to be really negative economically. It's going to be a challenge, of course, for them to get that through Congress. I think that what we're more likely going to see at the federal level is not major legislation. I think we'll get very little of that. We're going to see sort of a return to what we had the last 6 years of Obama, when you had a Republican House that sort of stymied him, and that is, all of the left-wing agenda items are going to move through the agencies. And really the fight over the next couple of years is going to be, to what extent can you shine a spotlight on abuses of regulatory power, generate public pushback, use litigation, use other tools to slow and stop some of that, because I think the whole global warming agenda is going to be back. That's going to be very negative for affordable energy in particular. I think that you're going to see a big push on the labor front to bring back all of the pro-union policies at NLRB and at the Department of Labor. And so, really, I think we're going to see familiar fault lines in all these fights. It's going to be similar to what we had under Obama, and it's really going to be about regulatory power principally. I don't see major big-ticket things happening in Congress. Maybe I'm overly optimistic because gridlock is one of my favorite things.
Yeah,
but that's my expectation right now.
Well, Phil, you mentioned risk cost earlier on, and it's something that's bothered me since the beginning of the flatten the curve part of COVID-19. Is it seems like the group that we're most concerned with, more than the health of the citizens, is the emergency rooms and the healthcare insurance providers on a quiet side, because they're getting hit pretty hard with costs that they weren't expecting. Copays are enormous for some folks as well. Is there a concern that this could lead to another push for sort of a single-payer Bernie Sanders version of Obamacare?
Well, we know the Democrats would like to do that. I think that basically everything helpful the government has done during COVID was of the nature of waiving or relaxing their own requirements and their own burdensome regulations. And I don't think that government has acquitted itself very favorably or engendered any greater trust that we would give them more power over our healthcare system. And so I think if they do that, we should be able to mobilize the public and push back on it pretty effectively. And I will say that, one of the very there haven't been a lot of positives in COVID, but one of them has been that utilization of healthcare was down dramatically, and there's some bad consequences of that because there have been a lot of layoffs in the healthcare sector and so forth. But the positive of that is we're going to see lower premiums because all of the health plans have all these big cash reserves from claims being down dramatically from healthcare utilization falling, and so we're now seeing a pretty significant drop in premiums as a consequence of that for this 2021 plan year, and that's unusual. People do not usually see premiums go down, but a lot of people are going to see that this year, so that'll be welcome, and that may take a little bit of the pressure for big-ticket federal health care legislation off.
Well, one of our favorite acronyms on this program and at the Virginia Institute for Public Policy is CON, as in Certificate of Need. We've discussed this with other guests as well. I'm curious to see your thoughts on whether this will encourage the General Assembly to relax some of our Certificate of Need regulations to expand perhaps the access to more health care in different places.
Well, I would love to see that. I think the idea that you need to prove that there's a demand for a service in order to offer it to the public is contrary to everything our economic system is about. We know that in practice, It serves only to protect incumbent providers and keep prices high. And, this could be an interesting time period in terms of kind of the creative reorganization of the healthcare sector, because we did, as I mentioned, have mass layoffs in that sector when the lockdowns were going on, because most places just didn't have a lot of COVID patients and they weren't allowed to treat anyone else or do elective surgeries. And so you had these sort of mass layoffs, and those have still not been reversed. And so you've got a lot of doctors and nurses out there who are currently unemployed. And they could start new things. They could build new things. They could be creative if there were not regulatory barriers preventing them. And I think that if we want to get the creative part of creative destruction, we've got to move government barriers out of the way.
Well, Phil Kerpen, American Commitment. So crystal ball time. I'm sorry, I have to pay Larry Sabato $5 every time I say that. But take a look. What does 2021 bring in the Commonwealth? Legislatively, does the legislature address the governor's unending ability to have a state of emergency? We've seen some lawsuits in Michigan about this. It's a blind spot that I don't think anyone ever thought of, but a governor can just declare a state of emergency and then not release it. Things like that, or, is this going to be sort of a quiet General Assembly session as they head towards the 2021 election cycle? And does this impact our 2021 election cycle here in Virginia?
Well, I'd really like to see legislatures assert themselves. The idea that when there's a virus around, suddenly executives can govern by dictate, not for days or weeks during an acute emergency, but for months and years. It sort of flies in the face of everything our system of government is supposed to represent. And if legislatures tolerate that, they're writing themselves out of the picture. And so I do hope that we'll see legislatures, including yours, basically say, this is not temporary, and we've got to pass laws, through actual legislation, and we'll take a look at that. And but the crystal ball question, will they? Probably not, because partisanship takes over, and I don't think that Democrat legislators want to limit the power of a Democratic governor.
Yeah, he's
and so, that's, I think, the challenge there. And I think same thing happens in Republican states, by the way,
true.
Which is why we're not really seeing we're not really seeing legislatures assert themselves anywhere very effectively.
Well, certainly the news that Terry McAuliffe's already raised $6.1 million for his gubernatorial rerun, and he doesn't even have the Lincoln bedroom to rent is notable and makes people sit up and take notice. Phil, I appreciate your time as well. What are you guys working on at American Commitment besides the COVID stuff? What can folks find there before we have to go?
Well, we've got a big project we call Commitment to Seniors that sort of exposes the malign influence of the AARP in these healthcare debates, because we anticipate that being pretty important over the next year as Biden sort of picks and chooses the parts of the Trump healthcare agenda to move forward or not. And we're going to be doing a renewed push on kind of, regulatory accountability and stopping regulatory abuses. We haven't really launched that yet because I think a lot of our activists are still hopeful that some miracle will deliver Trump a second term, and we don't want to ruffle a lot of feathers. But I suspect that when we finally get a concession and/or when Inauguration Day comes and people are more ready to deal with the unfortunate reality, we're going to launch a major effort to stop, Biden regulatory abuses.
Here's my answer when listeners of mine bring that up. I say, well, I didn't say he isn't going to have a second term. It just may not be back-to-back.
He may go back to Grover Cleveland. Yeah, good point.
Phil, thank you. God bless you, sir. And, we'll talk plenty of times as the new year dawns. AmericanCommitment.org, and you have a wonderful weekend.
All right, you too. Have a good one.
Coming up next, best-selling author and with the Government Accountability and Oversight, a new piece warning about the incoming AG, Christopher Horner, next on Freedom and Prosperity Radio.